but is more likely to die from breast cancer if she does. And we have higher rates of numerous curable, preventable diseases, including asthma, diabetes, heart disease, hypertension, because in part, we are almost twice as likely to lack health insurance. The health disparities that continue to plague our nation are not only by race and ethnicity, but also by geography, where many of our rural communities and our urban centers experience the greatest disparities. Maryland, we have the second highest number of primary care providers per capita, yet we rank 35th when it comes to geographic health disparities. While we are facing a primary care shortage throughout this country, this shortage is compounded in those communities. So as we implement the Affordable Care Act, whether it's the Health Benefits Exchange, Medicaid enhancement, expansion, the accountable care organizations, patient-centered medical homes, and the various patient protection provisions, we must do it with a commitment to addressing the health disparities that exist in our communities. That's why in Maryland, we're creating a series of health enterprise zones to eliminate barriers to care in the areas that have been underserved and suffer the most from health disparities. And I want to take this opportunity to sincerely thank Donna Christensen, because it is your proposal, the Health Empowerment Zone, that has inspired us at the state level to establish and develop the Health Enterprise Zone. So thank you for leading the way. Well, that's the beauty of this country, because when you live in a federalist form of government, you've got 50 states and territories that are experimenting and trying new ideas and innovative approaches. And we hope that what we're doing in Maryland will not only inspire other states to do this, but will motivate our Congress to do something at the national level. So thank you for the inspiring program. The idea behind the Health Enterprise Zone is simple. So just as we can give tax breaks to employers who we encourage to create jobs in economically distressed communities, we asked ourselves in Maryland, why couldn't we designate the areas in our state that are most in need of medical care and find ways to deliver to those areas the resources and care they need? So, with the support of Governor O'Malley, I convened numerous stakeholders, providers and payers and employers and community health advocates and the local health departments and Dr. Hussein's office. And we developed an initiative that would create these health enterprise zones in which we would provide financial incentives for the enhanced delivery of primary care and other community resources in targeted communities. Areas where we can use an array of incentives. And those incentives include loan repayment for physicians, job hiring tax credits. Maybe you want to hire a nurse practitioner. Capital grants. Maybe you need to buy medical equipment or improve the facility in which you are delivering the services, and other tax benefits to strengthen community health in the most isolated and underserved communities in our state. When combined, these tools will help us saturate underserved communities with primary care providers and healthcare services, ensuring that healthier Marylanders can live a better quality of life. We don't designate the areas. We have a list of criteria. This is what we're trying to accomplish, the disease we're trying to address. These are the outcomes we're trying to achieve. We are going to look to community-based resources, working with local health departments to identify those areas where they believe with a strategy they can make a difference. And then they'll identify which of the incentives, all, some, and certainly not none, the incentives that they will use to implement that strategy. In 3 years' time, will measure the results, and when proven successful, will take the program to scale and go statewide. We are investing $4 million in the program. Our goal is to create 2 to 4 zones. I believe we need to have one in a rural community. We need to have one in an urban center, and we need to have at least one in a community where cultural and linguistic barriers to access are what are the cause, or certainly one of the causes, to health disparities. 3 years later, we'll come back, we'll evaluate as we go. We'll do a 3-year post-assessment. We'll demonstrate to the world that it's successful, and we'll take it to scale. I'm really excited with this program. If anyone is interested in this program, please see Dr. Hussain at the conclusion of this program, and she'll provide you with all sorts of information on what we're doing. Follow us online, please. Right now, we have a leader in the White House, a partner in progress in President Obama. President Obama fought hard for health care reform, not because it offered him a political